issues for the House Republican leadership is health care reform and hospital reform. House leadership is really determined to eliminate the so-called Certificate of Need program that right now is required under, it was started by federal law, and it's required to approve all hospital construction. And the point the House Republicans say is that some years ago, that surgical centers, which are day surgery centers, essentially got a carve-out from that Certificate of Need law, and many surgical center projects developed as a result. The proponents say these surgery centers provide quality care, provide effective care, provide cheaper care than the traditional hospital setting. And this was all done through deregulation. So let's get rid of the CON board. The hospitals are dead set against it. They say, yes, there are problems with Certificate of Need, but it needs to be reformed, not eliminated. The other part of hospital reform was a big priority bill from House Speaker Bill O'Brien for specialty care hospitals. He's trying to attract the Cancer Center of America to locate one of its state-of-the-art facilities here in New Hampshire, probably in Salem. They've looked at property in Salem. Everything's hush-hush about where it is, but we know that much about it. And the bill the House passed really would not only exempt specialty care facilities from this kind of regulatory scheme I had been talking about, but also would exempt them from having to pay the Medicaid enhancement tax. It's a tax on bed revenue that, depending on the size of the facility, could be a $3.5 to a $5 million tax break for this new specialty care hospitals. The other hospitals are, again, much as they are the CON repeal, the other hospitals are absolutely opposed to a specialty care hospital getting out of having to pay that tax that all hospitals have to pay. Keep in mind, 10 hospitals have sued the Lynch administration about the Medicaid rates that are provided by the state, arguing that they're too low, they're too arbitrary, and they're unconstitutional. That's pending in federal court. So then to see the specialty care hospital that isn't even in New Hampshire on the side getting a total tax break made them angry. And the Hospital Association is a powerful lobby in New Hampshire. And their voice has been heard in the state Senate, where the Senate Health and Human Services Committee met until late in the night on Thursday night, gutted the Certificate of Need repeal bill. What they ended up doing was basically reforming the board. They took hospital members off the board and replaced them with appointees by the governor, and people who aren't connected with either the hospital industry or the insurance industry. The CON board would expire after 5 years unless it was reauthorized under the Senate plan. The specialty care hospital got rid of the tax break, which again, House Speaker Bill O'Brien is not going to like. They did provide for deregulation of these specialty care hospitals, as long as 65% of the patients come from outside the state. And if it's in Salem, they'll come from Haverhill, Lawrence, Methuen, Mass, even down to Lowell, Mass. Many of these patients won't be coming from New Hampshire. And that's a requirement because they wouldn't cherry pick from New Hampshire hospital customers. So here's another issue, hospital care reform. Big priority in the House, big changes in the Senate, big fight looming between the branches. Does that sound familiar? It should. And I'm going to be talking a lot in that kind of dynamic as this 2012 session winds down.